So that's the downside. The downside of surgery is, the risks of surgery, which are about 5%: stroke, paralysis, visual loss, brain hemorrhage. The other downside of surgery is, recovery, obviously, risk of heart disease, those kinds of things. Heart attack, pneumonia, blood clots. So, you can go, this is 6 of one, half dozen the other. You can go either way. The less invasive approach would be gamma knife and then possible surgery if needed. The more aggressive approach would be take it out and then treat the resection bed with radiation. So pull the weed and then spray radiation in the bed where you pull the weeds.
Which would you say is the best expected results?
Probably surgery with the gamma knife afterward. But if you want to avoid surgery at all costs, then you go the gamma knife.
The best results.
Your biggest challenge is not necessarily what's going to happen in your brain. It's what's going on in the rest of your body. I can control your brain disease. That's not a problem. We can do brain surgeries are fairly well tolerated. They're, for something like this, gets right anterior temporal lobe, which is a pretty safe area to go into. With a fairly low 5% complication rate. There's always that 1% if you have one of the horrible complications: stroke, paralysis, brain hemorrhage. That's there with brain surgery. Yeah, so your number's up then. It's like getting hit by lightning. But 99% of them don't have those really horrible complications. And you're otherwise healthy, so you probably would tolerate surgery fine if you're willing to go through with it. It's not really painful. It's a little tender afterward. Like I say, be in the ICU one day, in the hospital 3-4 days. But then we would still treat the resection bed with gamma knives. So you get gamma knife either way, to prevent any tumor from coming back, any microscopic contamination. But like I said earlier, we've seen this time and time again. Your biggest challenge, to taking care of this thing is them getting control of what goes on in the rest of your body. If the thing's out of control in the rest of your body and your brain looks perfect, you're in trouble.
Yeah, well, if my bone scan shows up glowing, then that means something too.
Do you have an appointment with a radiation oncologist? A radiation doctor? You haven't seen any? Okay. I'm going to refer you to somebody, and I'd like them to see you like early next week and see what they would recommend. I suspect they'll agree with me. They usually do, but sometimes they don't. They'll give you a different twist. You'll hear it differently, and you might say, you know what, I'm not going to do surgery. I just want to do radiation. But I'll send you over to them. I think you should see them. And if you, in the meantime, if you want to go the more aggressive route, then we can set you up for surgery. We can pick you a date in the next week, too. 7 to 10 days, we can get you on the books. But in the meantime, you see them and get their 2 cents. And if you after talking to them, you were convinced you just want to do radiation, then, then...
So with surgery, I can back out based on what the
radiologist
does.
The radiologist does like a whole body scan or something?
No, you have one. You just had a PET, right? PET and a bone scan.
Well,
the PET was last May.
It was last May.
And that was of the lung. Of course, the PET didn't show anything.
Mm-hmm.
And the biopsy was maybe...
They might want another PET, but...
Dr. Bibb said the PET won't show this.
No.
This kind of cancer isn't going to show anything.
You had the bone scan, though, right? Yeah. And I don't know,
so
you look pretty healthy. The bone scan, too, and people live with bone metastases for years and years. So, is that going to help us prognosticate? I don't know in your case.
Well, I'm feeling pretty good, actually.
Why did they take how'd they find your other kidney was in trouble? Or they just did a routine scan?
It was my blood work showed that the function was declining.
Oh, it was declining. And how is that now? How's your kidney function now?
21%.
Okay. That might scare away the anesthesiologist from surgery. That's the only other thing. Are you normal now, your function? What's left is working fine?
Oh, yeah.
You don't need dialysis or anything like that?
No, get down below 15%, then I understand I go on dialysis. And it improved this last
But we would have you see an internist 2 days before surgery. So if we got it on next Friday, for example, we'd have you see him. I don't know, sometimes it's 1 day before, but they would see you and give you, the clearance or no clearance. Do you have a kidney doctor?
Yes.
Like a nephrologist?
Some Chun Lee.
Okay, okay. I would ask him to, hey, you think I could tolerate anesthesia? Usually people can't. I'm very rarely seen anybody, get hurt, their kidneys be hurt by anesthesia. Usually it's because...
I had it in May, that's for sure.
What's that?
Anesthesia.
For the kidney?
Partial.
Yeah. And you did fine with that?
I hallucinated on morphine. It was crazy.
Really?
This was after the surgery.
Yeah. Usually if people get into trouble, it's just because they get dry. They get dehydrated with their kidneys. So as long as they knew that going in, I think you probably would be okay.
Yeah, they were dumping the saline in me. So.
Yeah. So, all right. Why don't we look at a surgery date? I'm going to get a radiation guy on the phone. You can go talk to them, see what they recommend, see if they change things. But in the meantime, we'll have a date on the books.
And an internist date as well.
Yeah.
Okay.
Okay. And you're going to call your nephrologist and just kind of.
Well, I have one question. Is it okay for me to continue to drive until we get?
Yeah, you haven't seized or anything, have you?
No.
No. Yeah, you're fine. There are risks with surgery, and we touched on a little bit, but the big ones I worry about in this area: stroke, memory loss, visual loss, brain hemorrhage, infection. Those are the biggies in this area. Okay, 90 to 95% things will go well. 5 to 10% you'd have a complication. Less than 5% something major, but 5% is a real number for someone, especially if I'm doing.
If you're one of them.
Right. It's 100 or 0 in that case, right?
Yeah.
You're the 100.
Yep.
Okay.
Gotta do it.
Alrighty.